Welcome, I'm Dr. Seth Rosenzweig, board-certified orthopedic surgeon, part of Louisiana Orthopedic Specialist, Acadiana's leader in orthopedics, spine, and sports medicine. We're also proud sponsors and supporters of the Acadiana local high schools and the University of Louisiana. This video will demonstrate to you the treatment of a common sports injury, the expertise needed to treat it surgically, and the successful recovery once completed. So this is a proximal hamstring rupture. He's about 20 days out, and this gentleman is in his 50s. You can see we've already draped out our area. We do a really meticulous job to drape out the other side of the buttock, and we're gonna isolate where our incision will be just in what we call the gluteal fold. And during the case, you'll notice we'll bend the knee up and down, and that'll allow us to change the tension on the hamstring while we're repairing. So we're positioned, we're prone, I showed you before, but this is after we drape to make a sterile field. This is the buttock, this is the hamstring area of the thigh. You can see most of us have what we call a gluteal fold, and I'm gonna pull a little tension, and this is where the incision's gonna go. Your ischium is right here. The hamstring may have retracted this far back. You can extend your incision this way, but we're gonna see what we can do and see if we can find it, bring it up. Your sciatic nerve lives here, so we'll make sure to look out for it, but the tendon itself should be around here. Okay. So we made our incision through the skin, through the subcutaneous tissue, and we came down to the gluteus maximus. Now, that is your most powerful hip extender, okay? And so right here, you can see me pulling the muscle. It's a big muscle, big boy, and we're gonna pull it upwards to get down to the hamstring interval. Now we're almost to the injury itself. Take them from me, please. So our injury is gonna be right under this. As I lift up the gluteus maximus, this is the hamstring, and his insertion is torn off. So we're gonna get that exposed, and we'll bring you back in to show how we get on the ischium. And at this point, we're starting to see the sheath of the hamstring. You see this nice big sheath, and there's a lot of blood in it. So as soon as I open this up, we should get the stump and some hematoma. My sciatic nerve, I can feel over here, and we'll identify it a little bit if it gets in the way, but I'm feeling it here. So it's plenty far away right now. Okay, so this is her gluteus maximus, the buttock muscle. I'm gonna have Jeff pull it out of the way. And right under that, you see this big tendon I just found? Are you able to get a good shot of it? Do we have my Army Navy? You see that?
Yes, sir.
That's the hamstring. And then the bone is right here. I'm gonna put some retractors over it, and we're gonna watch me sew it back into the bone. But this is probably 5-7 centimeters off of the bone. So I have my assistant Jeff around her ischium. He's protecting the sciatic nerve. It's right over here. And then he has one on top. And then remember, let me have this there. Here's our tendon. I'm gonna drill a little pilot hole for our first anchor. Just a little hole, just like that. And then what I'm gonna do is put the anchor in, and we'll take an X-ray, and you'll be able to see what it looks like on the X-ray. Come here, you're good. So we've got control of the hamstring now. You can see it's a pretty impressive tendon, and he still had a little bit of a semimembranosus attached, but you can tell his biceps and semitendinosus avulsed, okay? So we've got control of this, and I've actually had my assistants now, and I'm gonna try and get us a better look here. I've got Brandy on top of the ischium. Take it back, please, okay. And let me get Taylor right there, and I'll take the Mayerding. And let me finish putting in this anchor, guys, and I'm gonna show you the ischium, and that's where the hamstring attaches. And so there's lots of different ways to reattach these. A lot of us use what we call anchors, okay? The type of anchor I just use is made of metal, and I put it into the bone itself, and it has these strings coming out of it, okay? Okay, Justin, can you see where the anchors are coming out? Okay. So you can see, when I pull on it, you can see the backside comes up, and so I'll test this one. So you want to make sure these aren't going to pull out, because once I repair that tendon. So I'm going to begin to sew these into this to pull it back down. And then I'll do one more at the top, okay? So after I've tied it, I'll show you guys. Okay. So we've passed all our sutures, and one band of one side I ran multiple times. what we call a crackle, and then this one's still free. So this one still slides, and you can see it pulling the tendon back to the bone. So I want to see if I can keep my knee as straight as possible, because bending it relaxes it, straightening tightens it. So if I can repair this with it at its tightest position, that's safest for him, because I know I can get the length, and it looks like it wants to go. So what I'm going to do is start tying a knot, but look, we're going to actually catch these. So let's move these out of the way. There we go. Now I won't catch them. And
hold it with a stat, or
it's a sliding knot, so it's going to go, and I just pull out my slack, and as I pull, the knot slides. So it's pulling right up to bone. I'm right on bone, and I know I'm in a hole so you guys can't see, but I'm pushing the tendon onto the ischium, pulling out my slack, and now I'm going to back it up with what we call these half hitches, and I'm pulling out my slack, and that's on bone, and now I'm going to lock my knot, and we're going to repeat that. I've got about another 10 throws to make, and then I'm going to do one more anchor at the end, where I'm going to put some of these, put all of these strings, and then put it into an anchor again, guys. But as you can see now, the tendon is pushed up against the bone, and this gentleman's going to do well. And this is just one tie, and we've still got several more to go. But now the hamstring is on the bone, attached nicely. We're going to keep the leg ideally hip straight, knee bent for about a month. But my experience with these is they do rehab very quickly. And we're about to do our last anchor, and you may or may not be able to see the hole, but this is what we call a knotless anchor. And I've taken a bunch of the sutures that we've already tied, and I'm actually going to now, you can see I'm going to bring the rest of the tendon and sutures into that hole, okay? So let me do that. All right, Taylor, give me the suction one more time. I was trying to talk and work at the same time. There we go. Okay. All right, who's got the mallet? Okay, gentle. You can see it pulling the tendon with me onto the bone. And once I've bottomed out the anchor there, I start inserting it, and we are about done, guys. So we'll wash them very well, betadine, saline, all that good stuff, and begin our post-op protocol. Thank you for watching. Please subscribe to this channel to watch more of my videos. If you have joint pain or a sports-related injury, I'm here to help. I want to help you live your life to its fullest.